stabbing, searing pain, so debilitating that sleeping, working, or even thinking can be impossible. According to a national survey, more than 75% of all Americans suffer from symptoms like this, reporting one or more severe headaches annually, with more than 45 million people falling victim to recurring, persistent head pain.
Most people who live with a pattern of headache have migraine. And that means that they have inherited a more sensitive, a more vigilant nervous system than people that don't have migraine. When this nervous system is confronted with a variety of different triggers, things like changes in the weather, changes in hormones, stress in daily life, the nervous system becomes overwhelmed and it changes the chemistry of the brain. These chemical changes lead to the event that we call migraine.
Many individuals dealing with chronic and acute head pain turn to over-the-counter medications that may only offer temporary relief. Even more advanced medical treatments often only treat the symptom and do little to find and attack the root of the problem.
Some of the big myths about migraine is that they feel that migraine is just a bad headache, or that migraine is something that the tests are negative and they're just going to have to live with, or that migraine is caused by stress and depression, when in fact migraine is a very complicated problem that with proper diagnosis and management people can do very well with.
When seeking treatment, some are turning to headache and migraine clinics that provide patients with a comprehensive approach to treatment and diagnosis.
In a multidisciplinary approach, multiple professionals work with a patient. However, in our experience, we have learned that an interdisciplinary approach, where you pull those professionals together to work in a coordinated team with the patient at the center of that team, is more effective in managing not only headache pain, but chronic pain.
Migraineurs have a highly excitable nervous system. This means that change really affects them. For this reason, psychological and physical therapies may be necessary to help them balance this nervous system and make them less susceptible to disabling headaches.
While patients can receive expert care at a specialized clinic, treatment is only part of the remedy. The value of frontline clinical research has the added benefit of bringing new ideas for disease management to the public at large.
There's been a paradigm shift in research. Research has been moving from the halls of academia into the hospitals, clinics, and offices of practicing clinicians. This is important because it brings research to the patients that have problems that need real solutions.
Well, I feel like participating in the research has given me some insight in how to handle my own headache. Now I know when I'm going to have one. I know that I need to treat soon. It's taught me a lot about myself.
I feel good about helping others. This information that I'm providing in this study is going to tell other people how to take this medication and what doses, when to take it. It makes me feel like I'm a really big part of something.
For many patients, their visit to a specialty clinic was the first real relief they had experienced after years of suffering from headaches.
Before I started treatment, I was desperate. I mean, that's pretty much a word. I was in pain a lot and just didn't know where to turn. Now, after the treatment, I feel like I've got new hope. I feel like I've got my life back under control.
I came to the clinic because I've been having 14 to 15 headaches a month. My regular physician had recommended that I come see a specialist. It has made a tremendous difference. I'm not having the headaches that I was having. I'm down to about 1 or 2 a year, and I'm feeling just fantastic now.
Specializing in the proper diagnosis and care of individuals suffering from headaches and migraines is the Headache Care Center in Springfield, Missouri. Its individualized approach to care has helped hundreds of patients to take control of their headaches.
Today, we understand that migraine is a chronic disease. That means that people live with this genetically sensitive nervous system both during headaches and between headaches. What we do that is unique here is that we involve the patient. We make them the central part of their treatment through education, through giving them effective tools to treat their migraine, and most of all, a plan to put it all together so that they become managers of their own migraine.
Treatment at Headache Care Center encompasses a team approach from a variety of fields and disciplines: neurology, family practice, internal medicine, psychology, physical therapy, and nursing, with a firm focus on appropriate individual care. It is a program that helps patients learn how to manage their headaches and live more successfully between attacks.
At the Headache Care Center, we really try to find out not only what type of headache the patient has, but to understand the patient thoroughly through a multidisciplinary approach and empower them through education to manage their headaches through the rest of their life and decrease the negative impact of migraine on their life.
All too often, patients feel like they've been a failure, when in fact they've been doing the best job they can with the treatments they've been given. It's our responsibility to offer solutions to help them return to normal function.
Sometimes we think of medical research as something that happens in a test tube. But in reality, the best research comes from observations that we're making with our patients. Many of these research projects have become the platform for healthcare providers worldwide to better treat migraine.
ClinVest is on the cutting edge of research. We conduct clinical trials for migraine plus a variety of other disorders. What we learn helps to develop safe and effective therapies for this and future generations.
At Headache Care Center, our focus is on the clinical need of each individual patient. Because of our affiliation with ClinVest, which conducts research in headache, as well as multiple other areas, our patients may have the opportunity to participate in research studies.
The dedicated team of researchers and doctors at Headache Care Center, along with their patients, continue to work together to find new ways to better control pain and suffering.
The medical understanding and knowledge that is derived from specialty clinics like the Headache Care Center and ClinVest truly become a template for healthcare in the future. We believe in the patient-centered strategies. We believe that the healthcare professional and the patient should work together, creating a plan that optimizes and brings about the best possible therapeutic outcome.
For more information on Headache Care Center, contact them today or visit headachecare.com.